my name is Emma Holtzman, and today we will be discussing appendicitis. Here we have the table of contents, and we will be discussing the disease, the history, and modern practices. You may know of the world-famous children's book by Ludwig Bemelmans called Madeline. In the book, a rambunctious little Parisian girl named Madeline woke up from her sleep because something was not quite right. She had a horrible stomach ache, which turned out to be none other than appendicitis. We all know the book or have even seen the movies, but what really is the disease appendicitis that little Madeline faced? Well, that is what we will be discussing today. Let's start by discussing the disease itself, what the appendix is, and how it is identified. Let's start by breaking down the word. The start of the word appendis refers to the organ, the appendix. The suffix itis means inflammation. So, appendicitis is the inflammation of the appendix. Appendicitis is a medical emergency where the appendix becomes inflamed and must be removed. Before we get more into the disease, let's talk about the appendix itself. The appendix sits right lateral to the abdomen and is inferior to the connection between the small and large intestines, aka the ileocecal valve. It is a smooth muscle that is lined by columnar epithelial tissue. The function of the appendix has been a mystery for years, and many consider it to be a vestigial organ. But what some doctors theorize is that it could have immune functions and is a storehouse for good gut bacteria. Now, what causes appendicitis? It is caused by a blockage on the inside of the appendix due to an infection in the digestive tract. This infection can come from a virus, bacteria, parasites, or even if the appendix is blocked by stool. From there, the appendix becomes swollen, and if it is not quickly treated, it can burst, causing a major health concern as this can release its infection to the rest of the body. Appendicitis is extremely common and affects 1 in 1,000 people a year. It is also usually not a cause for concern, as long as the patient receives medical attention quickly. Now let's discuss some common symptoms of appendicitis. The most common symptom is intense pain in the lower right abdomen that progressively worsens with time. It may hurt when moving or pressing on the area. If the appendix bursts, the pain may move to the entire abdomen. Some other symptoms include vomiting, fever and chills, constipation, and a swollen belly. To diagnose appendicitis, a CT scan is used. A CT scan stands for Computed Tomography Scan, and it takes detailed X-ray images from different angles to examine the inside of the body. CT scans have a diagnostic accuracy rate for appendicitis of 93 to 98% of the time, making them extremely useful for diagnosing appendicitis. An inflamed appendix on a CT scan is found at more than 6 millimeters in diameter, as seen in this image. Some other scans are used to find appendicitis, like ultrasonography and radiologic evaluation, but CT scans have been the most successful. We will now discuss the history of appendicitis. In this text from 1561, Jacopo Berengario de Carpi wrote the first description of the appendix. He called it the additamentum, and that it is hollow and nearly 3 inches in length. Seeing as there were many years before 1561, it is safe to assume that appendicitis was untreated and not survivable. However, the first treatment for appendicitis occurred in 1735 by Claudius Amayand at St. George's Hospital in London. Here, he performed the first ever successful appendectomy. He performed the procedure on an 11-year-old boy whose appendix was pierced by a pin he had swallowed. One major issue was that the general anesthesia was not available until 1846, so any appendectomy before this year may have been successful, but also extremely painful. Once anesthesia was available, surgery was extremely successful without many troubles. In the 1940s, doctors began to use antibiotics to treat appendicitis, and it was found to be very successful. For some severe cases, surgery was still required. It was used during the Cold War, and men who were on submarines had their appendicitis successfully treated with antibiotics. During these times, 70% appendicitis cases treated with antibiotics were successful, but still 30% were not successful and needed to be treated with surgery. At the end of the 20th century, appendicitis was treated with a laparoscopic surgical approach. This approach allowed for a less invasive procedure and a quicker recovery time. You may be wondering, how is this done? Well, a surgeon will make a few incisions. one mildly lateral to the belly button, one on the midline of the abdomen, and one lateral to the midline of the abdomen. Then they insert a device called a port into these incisions. The location of the incisions can vary between people, but the ones previously mentioned are the most common. The port will then fill the abdomen with gas so that there is more space to perform the surgery. A small camera is also inserted to be able to see. The surgeons will use thin instruments so it is able to fit in the port. Finally, let's discuss how appendicitis is treated today. Most often today, the appendix will be removed through surgery. They use both laparoscopic and surgical techniques, which we will discuss more later. Modern medicine also still utilizes antibiotics, often administered before an appendectomy. Sometimes, people with less threatening cases of appendicitis will be treated solely with antibiotics and make a full recovery. Antibiotics are also used with older patients where surgery may cause another health risk. Some of the antibiotics used include Augmentin, Rocephin, and more. There are pros and cons to both antibiotics and surgery. Antibiotics, of course, are less invasive, but also pose a smaller risk for complications. But surgery has proven to be more effective because antibiotics may not always work. Though the modern solutions are fairly similar to those of history, modern medical advancement constantly improves these treatments, making them more effective. Let's now look closer at the difference between surgical and laparoscopic incisions. A surgical incision will be made on the inferior end of the abdomen and right lateral to the belly button, and the incision is about 2 to 4 inches. If the appendix has burst, a surgical incision is more likely to be used than a laparoscopic incision. In a laparoscopic incision, 3 incisions are made, and the procedures are the same as the ones I mentioned earlier for laparoscopic incisions. Many believe that laparoscopic incisions are better because they are less invasive, and the recovery time is shorter than a surgical incision. Before we end, I would like to tell you all about my experience with an appendectomy. Here's a picture of me when I came home from being in the hospital for 16 days due to appendicitis. When I was 5, I had horrible lower right abdominal pain, which ended up being appendicitis. The whole start of the story was sort of a boy who cried wolf situation. When I was that age, I faked many stomach aches to get out of going to school. But the one time I actually had one, and a severe one at that, my parents did not believe me until my school called home saying that I was really sick. Interestingly, I was misdiagnosed with a kidney infection before they realized it was appendicitis. I had an ultrasound done to identify my appendicitis, and when they realized how big my appendix was, I was rushed straight into surgery. Right as the surgery started, my appendix ruptured. They then removed it and planned to give me antibiotics at home through a PICC line to treat any infection, but this plan changed quickly after I experienced even more pain. A few days later, they found that my appendectomy caused an obstruction in my small intestine that made my intestines non-viable, meaning my intestines were not able to perform peristalsis. They ended up having to remove a foot of my small intestine and performed a bowel resection. Interestingly, 3% of people who have appendectomies end up with a small bowel obstruction, so I guess you could say that my case is pretty special. It is interesting to learn that a very common and harmless procedure could still have complications, but thanks to modern medical treatments, I was able to make a complete recovery. Thank you so much for watching this video, and I hope you learned a little bit more about such a mysterious organ and one of the most common diseases in the world. Here are my references. And here's my honor code.